Starting on February 11th, the federal government will deliver vaccines directly to select pharmacies across the country. This will provide more sites for people to get vaccinated in their communities, and it's an important component to delivering vaccines equitably.
The White House COVID coordinator announcing their latest move to get more shots into people's arms. But the push to vaccinate, it is facing a lot of headwinds. Many people still scared to get inoculated, and anti-vaxxers, they're helping to only fuel those unfounded fears. One of the largest vaccination sites in the country, Dodger Stadium, temporarily shut down over the weekend by people actually protesting the vaccine. Also, the pace is picking up a bit with more than 1 million people a day getting the vaccine, and there have been 26 million doses given out in total. But Politico reporting that 20 million doses that have gone to states that are unaccounted for. You heard me right, obviously making it harder to speed up the vaccination efforts. Plus, there are open questions about the new variants. My next guest just penned a piece in the Washington Post questioning whether the vaccines will be effective on the mutations. I want to bring him in. John Barry, he teaches at Tulane University School of Public Health and Tropical Medicine. He's also author of the bestseller, The Great Influenza, the story of the deadliest pandemic in history, which is about the Spanish flu in 1918. As always, John, I appreciate the time. We'll get to the response in a second, but what I really got from your piece was we've got a race, and I'm curious from your perspective, is the more important of the two races adapting the vaccines that we have to keep up with the mutations, or is the more important race, even if it's not perfect, getting these vaccines into as many arms as possible as soon as possible, and just to accept that this will kind of become almost like the new flu, where every year we have to readdress the new strain of this thing?
Yeah, I think number two is the most important, getting as many people vaccinated as fast as possible. You know, the virus does mutate. It does not mutate as fast as influenza, fortunately, but it has shown signs in South Africa and Brazil of escaping immune protection and escaping the vaccine. Now, the vaccines are still effective against both those variants. They are not as effective as they were against the virus they were designed about. But the more people who get vaccinated, the fewer opportunities the virus will have to spread, including the new variants. And that means you can slow down the mutations because the virus won't have as many opportunities to multiply. So I would definitely say getting people vaccinated is the most important in that race. But you still have to plan to make adjustments in the vaccine in the future.
So, John, let's go from the remedy to the response. Listen, West Virginia, and no offense intended, is very rarely held up as the gold standard in terms of, beating the rest of the country. But if you look at how they've gotten more shots into arms and they've gone outside the federal government to basically do it on their own in terms of how to handle the supply, et cetera, is that a tell? Is it just a hangover from a lack of coordination from the previous administration, let alone a lot of ineptitude on their part, that these guys have basically start from zero here and get to 60 miles an hour, in a day? What do you attribute to the major problems we've had with bottlenecks, 20 million missing doses that are unaccounted for, and so many of the other problems?
Well, again, as good as the federal government did, really a scientific community, largely funded by the federal government, although Pfizer's vaccine didn't have those guarantees, as well as they did in developing the vaccine, and as well as they did in delivering the vaccine to the states, the last mile, there was very little planning done in that last mile of going, once it got to the states, in terms of getting it into people's arms. So, right now, states are still needing to develop best practices. There was not enough guidance from the federal government on that part of the delivery system. And we need more coordination. States need to figure out rapidly, with hopefully federal guidance, the best way to get this stuff out there. Things are moving better. For example, I'm in Louisiana. which in the first few weeks was near the bottom, but it improved dramatically. So things are changing, and hopefully you want to race to the top, not race to the bottom.
Absolutely. Finally, you're the perfect guy to ask the impossible question to, because as a historian, but also as a scholar in this field, through the prism of history, do you feel where we've had from the scientific advancements in terms of now these vaccines, and also the people that will be listened to, at least at the highest levels of government, and those that are positioned in the important positions as we speak, if you and I speak summertime here, late summer, are we going to be a good place, not just in this country, but globally, that we're getting our arms really around this thing? And I don't know what normalcy will look like at that point, but we'll be closer to it than where we are now.
Well, before these two variants surfaced, or three variants, I guess, the United Kingdom, Brazil, and South Africa, then I would have been very confident saying this next football season, there are going to be people in the stands, 80, 90,000 people. Those variants have surfaced, and it remains to be seen. A lot of it is going to be dependent upon how many people get vaccinated. You know, the goal is herd immunity. You want herd immunity to arrive through vaccination, which means people aren't dying, and not through the spread of the disease, which means people do die. But, you know, we would probably need the old estimate before these new variants was, 60 to 70% of the population to be either vaccinated or have been infected to achieve this herd immunity. With these more infectious variants, if we do not get enough people vaccinated to control them, then I think we'll probably need, closer to 80%, possibly even more than that, people infected or vaccinated. So, the fall becomes more questionable. That's one area that I'm no longer confident in making a prediction. A couple of weeks ago, I would have said something different.
John Barry, I appreciate the time as always. Thank you so much.
Thank you very much.